When someone is a patient in the hospital, very often there are many people that are coming in and out of that patient room. And very often, that patient does not know who is who. Many times, they don't know who the nurse is or the nursing assistant. Only with good communication, being verbal and nonverbal, will RNs and CNAs be able to effectively and efficiently accomplish their main goal, which is to provide excellent patient care. And with good communication, whether it is verbal or nonverbal, trust and corporate encouragement will good working relationships between RNs and CNAs be possible. First, communication. Nobody should assume anything. RNs don't assume that that room down the hall that our patient Fred is going to be going in, that room is clean and ready to go. Or don't assume, the RN can't assume that that patient has arrived. And the CNA can't assume that just because Sally the nurse was looking in the nursing assistant's direction, that she saw that the patient is here and ready for evaluation. Active listening and watching is very important between nursing assistants and RNs. Both need to pay attention to nonverbal cues and be aware of the surroundings. They need to know, is the nurse down this hall or is she down the other hall taking care of Bob? Because Sam down the other hall needs attention at this moment. Somehow they have to be able to communicate and know what the other is thinking and doing. And we all know that mind reading is not the easiest thing to do. Trust. Trust is important. The RN has to be able to trust the CNA, but that doesn't mean that she should go into the patient room every 2 minutes to see to make sure that nursing assistant is doing her job. And the RN should be aware of the nursing assistant's patient load, where the RN only has 5 patients that she has to tend to. Many times the nursing assistant has twice that many. The nursing assistant, on the other hand, has to trust the RN. Trust the RN that she is giving the assistant tasks that she is qualified to tend to, and that the RN is actually going with the patient's care plan. Corporate also plays a role in RN and CNA relationships. Many times, RNs are awarded where CNAs are not. That's because there aren't the awards out there for the nursing assistants. Where I work at Aurora, I know we have the Aurora Star, and there's a Daisy Award, and there's one other one that I can't think of right at this moment. CNAs have none. Compensation. Right now for COVID, RNs can make twice as much an hour for working extra, where CNAs get only a portion. When those things happen with the awards and the pay, CNAs feel devalued and they don't want to pick up the extra hours. So it's important for corporate to pay attention to those things. Corporate needs to encourage teamwork encourage conflict resolution, and support outside of work team building. These are all important things to keep nursing assistants and RNs working well together. By not leaving anything left to assumption, such as tasks being performed, trusting each other, and expression of coworker value, a good working relationship can be built. Nurses and nursing assistants have been working together for decades. And their jobs are very similar with a few differences. But the main purpose is to provide good and safe patient care. And for decades more, they will continue to do so.